Hi, again, this is Dr. Cedeno from Houston Dermatology and Plastic Surgery. Today I would like to continue talking to you about acne and how we treat it. This is the part 2 of our series of education about acne. So the first one we talked about what acne is, and today I would like to spend a little more time talking about how we treat it. So there's multiple types of acne. Mild acne, which would be comedonal or very basic, where there's tiny little skin color papules under the skin or blackheads. Then there's inflammatory acne, which is mostly papules and pustules, the pus bumps, the ones that are more juicy and pink and slightly painful. And then the severe type of acne, which comes in nodules and cystic lesions that linger under the skin for weeks or even months, and we often need to inject to make smaller. So acne treatment varies based on complexity, based on the type of acne that you have. And so we start with skin directed therapies, salicylic acid, benzoyl peroxide, and then we add topical antibiotics like clindamycin. We used to prescribe erythromycin, topical erythromycin in the past. That's not the case anymore. We use topical dapsone, Axone gel, which works very well. And we also have combinations of these antibiotics with benzoyl peroxide or with retinoids like adapalene. So those work very well for mild acne. For more inflammatory acne, we use some other, I would say, systemic medications, things that are absorbed by mouth and the gastrointestinal system, and that decrease inflammation in the pilosebaceous unit, which is the root of acne. Okay, and for that we use doxycycline, we use minocycline, oftentimes we use Bactrim, some people use amoxicillin, and some other people use dapsone by mouth. So these are not long-term therapies. These are normally restricted to 3 months. In women, we have benefits from birth control and spironolactone, both which control the hormones that drive acne. And lastly, for severe acne, my go-to, or for recalcitrant acne to other therapies, my go-to is Accutane, which I will talk in a separate video because I like talking to my patients about all of the side effects, length of treatment, and what they can expect in the short, the medium, and the long term. There are other types of therapies which are considered non-standard of care, like red light and blue light and chemical peels with salicylic acid, glycolic acid, the Gesner chemical peel. Some people use IPL, intense pulse light, or in the 430, 450 nanometer spectrum, or blue light. And some other people use long pulse Nd:YAG lasers to treat acne. But again, these are not the standard of care and obviously not covered by insurance. So if you have questions, please engage in our social media platforms and let us know.